everybody, welcome to another episode of The Fibroid Doc, where I'm going to be sharing information with you to help you live a life free of bleeding and pain. So we're doing a series right now on fibroids and infertility. So I wanted to show you something really cool in the operating room. I just finished today doing 5 cases of hysteroscopy. So I'm going to go over that procedure. It's a very common procedure done especially for women with fibroids who are undergoing treatment for fertility or who want to get pregnant and who see or find fibroids in the cavity of their uterus. So what does this all mean? I'm going to show you a quick picture. So if you look right here, this is the uterus, and right here is the cavity of the uterus. This is the inside where you see these 3 black dots. And the inside of the cavity is where a baby would form, for example. And this is where your tissue sloughs off every month and you get a period. So sometimes fibroids can form inside this cavity. So I just made 3 dark circles to signify fibroids. And when you have fibroids inside the cavity, as you can imagine, it's difficult sometimes for an embryo to actually implant into the cavity. Or an embryo can implant onto one of those fibroids, and then that could lead to a miscarriage. And so if you find out that you have fibroids inside the cavity like this, your doctor would likely recommend that you have them removed. Or if you are undergoing the process of IUI or IVF, which is in vitro fertilization, before they actually put in an embryo, they're going to want you to remove these fibroids so your uterus can be nice, your cavity can be nice and clean, okay, right there, and implantation can occur without a problem. Okay, so that's the goal of this procedure, and so with that, let me show you what a hysteroscope looks like. Okay, so this right here, so this is a hysteroscope, and essentially it is a camera. There's a lens right here. There's a lens portion, there's a light cord, and this is a system now that is going to go right into the cervix and through your vagina, into the cervix, and into your uterus to then remove these fibroids. So it has a light, there's a light cord, and so when I turn it on, I can actually put it right through a patient's, you can see right here, you can go right through the cervix, and when I get to the uterus, I have some light, and it's going to help me see what's going on in the uterus. And if I had fibroids like that, the ones that I showed, I'm going to be able to see them. And then I'm going to be able to use different types of blades to actually shave these fibroids off so that the cavity can be nice and clean at the end of the procedure and ready for implantation. So we have different types of systems that help us do this. I personally really like the TrueClear system, and that's the device that I use. And I'm going to show you the blade. So there's different types of blades here. This is a very small, thin blade that helps with very fleshy polyps. And then we've got 2 other blades that are much tougher that can help with fibroids. Okay, and so I put this into my camera, and then I put the whole thing into the cervix, into the uterine cavity, and then I'm able to actually, if you come really close here, you can actually see, or maybe you can hear, how this blade moves. I press a pedal, and this blade moves and slowly can shave off a fibroid or a polyp. Okay, so you may be able to see the oscillation of this tip, and so sometimes this takes 1 or 2 minutes if it's a very small and fleshy polyp, and if it's a tough fibroid, it can take upwards of 20-30 minutes. But overall, this is a very quick procedure. Sometimes I put this in and then I realize, oh, it's actually a really tough fibroid, and then I take this blade off and put in another blade. And so it offers a lot of flexibility, and this just, there's a suction system also that sucks out all the chips of the fibroid or polyp that we remove. So today I actually did 5 of these cases. So back to back, they all went well, and in some patients I had polyps, in some patients I had fibroids, but this is what a hysteroscopy is all about. And this is an outpatient procedure. You can get it done and leave within an hour or two, and same day recovery. And this is a very efficient procedure, and one of the most common ones done for fibroids and fertility. All right, so I hope you learned something, and please comment if you have any questions, and we'll see you in our next episode. Thank you. Bye.